Good afternoon to everyone. Today we are here to discuss the COVID vaccine, and we are joined today by Father Liam from St.Edmund Campion in Maidenhead, and we have our Councillor Stuart Carroll from the Royal Borough of Windsor Maidenhead, who's our health chief, the lead member for health, and he's here to answer questions from members today. So I'll pass over to Father Liam. Thank you again for everybody joining us today. Thank you, Father Liam.
Thank you. So we begin this meeting with a prayer asking the divine to lead us with courage and with love. And so first of all, to our brothers and sisters who have contracted and are suffering from the coronavirus, we pray that God's healing hand may rest upon you. To medical doctors, nurses and supporting staff who are in the front line of the fight against COVID-19, may God sustain you and inspire you to render your life-saving services with due care, love, and compassion. To all those who've lost loved ones due to coronavirus outbreak, we convey our deepest sympathies. And we pray that your loved ones, their souls, through God's mercy, may rest in eternal peace. We pray that God may grant all bereaved families consolation and strengthen your faith and hope. Loving God, give us the grace to hear your voice and the strength to continue working with love, hope, and peace in this time of pandemic. Do not allow us to be indifferent to those who today suffer the loss of a loved one or who suffer from the absence of work. And finally, God, give us the courage to accompany and side with those who suffer discrimination, violence, or injustice. Amen.
Thank you, Father Liam, for that lovely prayer. And now I'll pass over to Councillor Stuart Carroll.
Thank you very much, Gertrude. Thank you, Father Liam, and thank you to the panel who's also joined us from St. Edmund's Campion Church in Maidenhead. I'm very, very grateful for everybody's time today. Gertrude and I have been doing a number of question and answer sessions on all things coronavirus, and in particular the COVID vaccines. And I would just like to open up the opportunity for people to ask questions about the vaccines themselves, and also to give their thoughts, their opinions about why it's so important to get vaccinated. So it's a very open forum. I just would like to start off actually by saying a huge thanks to Father Liam and everybody within the church for all their leadership during this extremely difficult and crippling pandemic. I'm acutely aware of the work that the church does in terms of volunteering, in terms of helping, assisting, and I think particularly during this difficult time, actually giving people a lot of solace, faith and hope. I'm a regular visitor to St. Edmund Campion School. I've got two nephews there, and also as the lead member for Children's Services, I have been recently liaising with the head teachers there to ensure, like with all our schools in the borough, they are being supported as is needed during this difficult time. But I just want to start by saying a big thanks to everyone, because I do know firsthand the first class volunteering effort that's going in. And as I say, beyond that, I actually think faith across all the faith groups during this difficult time is really, really imperative. So I'm just going to open it up. Please come in with any question you want. We don't have any script here. Any question goes. Very happy to try to answer your questions. Who would like to go first? Yes, please come in.
My name is Teresa. I lost my husband to COVID when it was the first time. So he died on the 4th of April last year. And it was the most horrendous experience. So I absolutely believe it's absolutely essential for everyone to get a vaccination. And what I wanted to ask is, if we do get a vaccination, does it lead to herd immunity? Is that how it works?
Thank you very much for your question, and first and foremost, my deepest condolences for your loss. This is a really difficult pandemic, and particularly when it touches us personally in the way that you've described. But I really appreciate you also coming on this panel today to speak and share that experience, and moreover to say, as you have so clearly and emphatically there, the need to get vaccinated, and I really, really welcome that. It's a fantastic question you've asked, a really, really good question. So herd immunity, just for people watching who don't know what that is, it's a slightly bizarre phrase, but it's a very important phrase. Herd immunity is the notion that if someone gets vaccinated, they effectively can protect other people who maybe haven't been vaccinated because they don't pass on the virus, they can't onwardly transmit, to use the technical parlance. The answer to your question is, at this point, we don't fully know, but there's a very important and positive but here. The initial findings from a recent AstraZeneca Oxford study to look at that vaccine has suggested that from that vaccine that there is some herd protect. So effectively what that means is people who were vaccinated, it would appear, did curtail transmission, onward transmission. In that particular study, it suggests by as much as 67% transmission was reduced, so not necessarily fully or completely, but it was certainly restricted and curtailed. Now, it's important to stress at this point, those are provisional indicative data, and with all these things, we have to follow the science, we have to follow the data, and things have to be validated. But that is a really positive initial finding. There's no reason at this point to think that wouldn't apply to the other vaccines which have been approved, which is the Pfizer vaccine and also the Moderna vaccine. But we have to look at that in a lot more detail and start to really understand the mode of action of the virus once someone's been vaccinated. So we know that these vaccines certainly can provide individual protection, and to a very, very high level. What we're a bit less clear on is how that virus then sheds when you have an immune response, and that what we call shedding, which is basically when the body gets rid of the virus. What does that mean in terms of how it sheds in the environment, in terms of the particles and the molecules, and then, of course, the ability for that to pass to another person? I think what I would say, though, is that that initial set of findings does speak to a strong hypothesis that these vaccines should curtail some form of transmission. And why is that important? Well, of course, it's important in the obvious sense that it stops transmission. And, you know, when we look at this pandemic, the big problem we've had is that the virus is very virulent and it's very potent, and it can transmit from one person to another very easily. But what it does speak to is the rationale behind getting vaccinated, not just to protect yourself, but to protect other people. And I think, you know, when we think about vaccination, and I know I've spoken to Father Liam about this before, you know, it's not just about ourselves, it's about our social responsibility, our community responsibility. And I do think that's a very powerful message we need to get over to people, that yes, of course, you should want to protect yourself, absolutely. But it's more than that. This is about playing a role for all of us in our community. And of course, it's through vaccination that we will get through this pandemic, but we will also save lives and we will stop illness. And so therefore it's a very big thing.
Thank you.
Indeed. I remember, Teresa, when Richard, your husband, died, sadly, and it is very sad, it was the first of quite a number of funerals that I have officiated at in Maidenhead and elsewhere, people who succumbed to COVID-19. And it's heartbreaking, and the grief. And some of them were very young people from all different ethnic backgrounds. It's amazing. This is not selective. This disease passes everywhere and to all kinds of people. One question I'd like to ask, and I've heard this, I assume it's a myth, that if one has had coronavirus or COVID-19, say in the last 10 months, 11 months, they feel they don't need to be vaccinated now because they've built up an immune system. Is that true or false?
That's another Excellent question. Really, really important question. The ultimate answer to that is we don't fully know, but what we do know is that even though someone may have generated an immune response, we don't know how long that immune response may last for. So it's one thing to say that someone's had the virus and recovered from the virus, but to what extent does the immune system have what we call a memory? How long can that memory last? So if the virus were to enter the body again, would the immune system know what to do in order to break down the virus and to stop the disease progressing? And the other critical thing to mention here is that for a lot of people, their immune systems are not necessarily as strong as they could be or used to be. So this is particularly the case with elderly people, people with underlying health conditions. We know that sometimes, sadly, their immune systems don't have that strength of memory and also don't have that potency of response. So what is absolutely vital, particularly for those cohorts, is that they do get vaccinated, even if they've had coronavirus and recovered, because what the vaccine is doing is very effectively giving the immune system the weaponry, the memory, to know how to break down the virus should it enter the body. And even for someone younger, and we have to remember that with coronavirus, sadly, even some very young people have passed away from coronavirus and COVID-19. And sometimes even younger people have underlying health conditions which they didn't know they had, because sometimes health conditions don't actually become pronounced until you're older and you start having actual symptoms of those underlying conditions. In those situations, in those circumstances, again, it's vital people get vaccinated. The critical message here is that there's only benefit, there's only upside from getting vaccinated. There's no negative here. So the vaccine is only going to give you, at the bare minimum, extra protection, if not actually in many, many cases, absolute protection. So my strong argument would be absolutely go and get the vaccine. Don't play a game of chance with natural immunity. It's far too risky. We've just heard from Teresa there, very courageously talking about her late husband. This is serious. This is serious. We're talking about real people here. This is not the part of our world or our life we want to be playing a game of chance with. So I absolutely urge everybody to go and get the vaccine.
I have a question. So I understand there are a few or different vaccines out there. So which of the vaccine is the right one to take? Because I understand there are different strains. So how would we know the right vaccine to take that is 100% effective to all the strains and the side effects as well? Because I have a daughter who has, allergies, and I have asthma myself. So I am a bit hesitant in taking the vaccine due to these reasons, because I do wonder what sort of allergies or reaction, could occur.
Yeah, thank you for the question. And like I always say, there's nothing wrong with people having questions and concerns. That's perfectly normal. It's perfectly natural. I think the critical thing is that people always get their information from credible, official, independent sources. In the first part of the question, in terms of the vaccine, so the way the system is working is people can't choose which vaccine they get. The National Health Service is administering the vaccines on a rapid basis across the board. And so far, the independent committee called the Joint Committee on Vaccination Immunisation, or JCVI for short. You probably hear these random acronyms buzzing around the media. They have said at this point that they can't really distinguish between the vaccines as to which one is potentially better than the other one. What we do know is with the Pfizer vaccine and the AZ Oxford vaccine, which are currently being used, that the levels of efficacy are extremely high for both vaccines. In the case of AZ Oxford, they use slightly different clinical endpoints to the Pfizer vaccine. So this isn't a case of apples with apples, it's more apples and oranges. You can't directly compare the two vaccines because they were being tested against different clinical endpoints. What we do know about the vaccines is, though, that they are highly effective. and that they do work. Now, in terms of the point you just raised around the variants, which is another excellent point to raise, work and more studies are ongoing to understand the extent to which these vaccines are going to be effective against the different variants. So actually, just a couple of hours ago, there was an initial study that's been reported from Pfizer, which is suggesting the Pfizer vaccine will be effective against the South African variant of coronavirus, which is fantastic news. Moderna have also done some initial laboratory examination. That's another vaccine that's been approved for use in the UK, but supply won't be available until probably March or April. But again, it would suggest their initial laboratory examination, the vaccine is going to be effective against that variant. What we know with the AZ Oxford vaccine is that it is effective against the Kent variant, which is one of the most prominent variants in the UK at the moment, which is circulating. The vaccine efficacy, again, based on a study, is very high. And even against the South African variant, the initial AZ Oxford studies have shown that it is effective against stopping what we call severe disease or hospitalisation or death. It may be less effective for so-called mild, moderate disease, but it certainly looks like it's effective when it comes to the more severe end of the scale of the disease. So all of those findings are pretty positive. Again, it's a question of science and follow-up to understand the nuances and the differences. But one thing we can also be prepared for is that if needed, these vaccines can be tweaked going forward to have different variants, different strains of the vaccines included, a bit like we do with the influenza vaccine every year, which includes different strains of the virus. In terms of safety, this is a vital point. I think it's worth me just spending a few minutes talking about safety and how these vaccines are assessed, because I think this is a critical message. So first and foremost, the UK has genuinely, I've been working in this area for nearly 20 years, a world-class regulatory system. So another acronym you will have heard on the news. We love our acronyms in this area. The MHRA, the Medicines Healthcare Product Regulatory Agency, a bit of a mouthful, so hence why we just always go with MHRA, is an independent regulator. And that's an important point because by independent, it has no political interference. Boris Johnson, Her Majesty, the Queen herself, can't tell the MHRA what to do. They're independent and they are legally constituted to be independent. So they base their decisions and their analysis purely on science and data. And they approve these vaccines following a very, very rigorous assessment of three critical criteria. The first, safety. Second, efficacy, does it work? And the third, quality, can it actually be properly administered to a population? And it's on those terms, following extremely extensive review, that they approve the vaccines. Now, it gets better because on Friday last week, the MHRA published, and it's available online, we'll include this link when we send this video out, a comprehensive, what we call surveillance monitoring study. So even after a vaccine has been approved for use, and also I should note that when a vaccine is issued into the system, into the NHS, there is a process called testing and batch release that's done, which means every single vaccine that goes out is tested for its quality by an independent body within the MHRA, responsible for biological standards, to again make sure that vaccine will be safe. But then the MHRA do surveillance monitoring for what we call pharmacovigilance. That's a trendy, fancy word for basically saying, does it have any side effects? Does it cause any illness? Now, based on their report they published on Friday, they looked at over 10 million doses of the vaccines of Pfizer and AZ having been administered from just before Christmas through to towards the end of January. So that's a huge, huge number of doses, one of the biggest surveillance studies ever done. And they concluded that the vaccines are safe. There were very, very few severe adverse events. In the ones identified, that would seem to be based on those individuals sadly having an underlying allergy, not the vaccine itself. And only 3 out of 1,000 doses administered was a side effect reported, and the overwhelming majority were what we would call mild side effects, so things like injection site reactions. So when you have the vaccine and it pierces the skin, sometimes your skin can slightly inflate. That's not actually the vaccine, that's just the needle. Obviously the body isn't designed to have things pierced into it, so that's a natural consequence, and maybe a little bit of fatigue and a slight headache. So I think based on that study, as well as the clinical trials, we can be assured that these vaccines are super, super safe. The one thing I would say on allergies is that, and this is true of all vaccinations, this is not unique to COVID. Of course, if someone does have an allergy, it's very, very important that they talk that through with their healthcare professional and that they have a direct discussion about what that allergy is. Hopefully that allergy will have been tested in the past. And then look at what's called the summary of product characteristics of each vaccine to see what the ingredients are within the vaccines. The good news with these vaccines is that they use what we call artificial ingredients, because they're designed to create an immune response. They're not actually the virus itself, so they've got very few combinations of ingredients, which is good from an allergy point of view. But nonetheless, I do encourage anyone, it's very, very important, if you've got an allergy, talk it through with your healthcare professional, and then a clinical risk assessment can be taken, and then a proper, sensible decision can be taken about whether you should have the vaccine or not. But in the vast majority of cases, people can have this vaccine, they can have it safely, and they can be assured that it's not going to harm them in any way.
Thank you very much for that explanation. It was very helpful to hear the research behind it and the data collection, and of course the acronyms you've mentioned as well. So thank you.
And no, thank you for your question. And can I just also say this? I think this is important to say because we can all sort of get into the science of it, and I'm a bit of a data geek, and I love the science and all the rest of it. But my parents actually just texted me about 3 or 4 hours ago saying that they've heard that they've been scheduled for their vaccines on Wednesday morning of this week. And Professor Jonathan Van Tam, who I work with very closely, who many of you would have seen on the news conferences as the Deputy Chief Medical Officer, he talks about the mum's test. Would I have my mum have it? Well, his mum has had it, had the COVID vaccine, and that hit the press. My mum is having her vaccine, and my dad's having his vaccine. I've 100% encouraged them to get the vaccine. They're going to get the vaccine. That's my own parents we're talking about here. So, you talk about putting it on the line. Well, I'm convinced these vaccines are safe because I've got my mum, my dad, actually my aunt, my other aunt in Newcastle. So there's plenty of people I know getting the vaccine. They've all come to me and said, Stuart, you know about this. Just want to sort of, run it by you. Is it safe? And I've said, absolutely, it's safe. So I think it's just important to say that as well.
Stuart, hi. I'm a local nurse in the area as well, and just to back up what you've said, I've had 2 doses of the vaccine, and I'm very grateful to have it. And I just want to put out there as well that we are very lucky in the UK to have such a robust screening service, and the vaccine is safe, it's effective, and it's our way forward out of this pandemic. So I'd really encourage people to trust in this, the researchers, and trust vaccine.
I think that's such a great message, Margaret. And thank you for what you're doing as a nurse. Again, what an extraordinary time we're going through, and I think our NHS staff have just proven to be absolutely immense. I think we're so lucky to have a National Health Service. People sometimes complain about it, and okay, look, no service is perfect, but I think we've got the best service in the world. I've been working in and around the NHS for a long time. I've been a user of the NHS myself. I've family members, friends use the NHS. I think it's a fantastic asset we've got. But of course, the reason it's a fantastic asset is because of the people within that service who are doing such extraordinary things at the moment. So I'm really pleased you've got your vaccine. That's wonderful, and you've had the 2 doses. And again, a fantastic message to go out there that you've got someone on front line, someone who's a professional, they've been vaccinated, it's safe, it works, it shows how important it is. And, you know, as I constantly say to people, this world is hard enough, but the only way we are going to get through this is through vaccination. That's the only way we're going to come through this pandemic and get into a new normal. And there is a responsibility on all of us who can have the vaccine, which is the overwhelming majority of us, to get it.
And just, I give the vaccine down at the centre as well, and it's just to, if anyone's out there worried or they've got any questions, you know, still come for your appointment. We sit with you, we go through all your concerns, you know, we go through the side effects, we make sure that you're suitable for the vaccine. And it just, yeah, it's just to reinforce, because there's a lot of people out there who are weary, you know, who don't have access to all the information that a lot of other people have through social media. And it's just to say to everybody to, yeah, you know, when you get your appointment, come down and see us. And as I said, you know, nothing's rushed, it's all talked through, and any queries you have, we'll, you know, talk them through with you. There's always a GP on site. So yeah, it's and it's a great atmosphere down there. It's a real buzz, I should say, that, you know, there's people who've been in isolation since March, who've not been out, who've not seen family, who've not seen friends, and they're almost prisoners in their own homes. And to have the access to this vaccine that's free, that's safe, that's effective, you know, we're just so lucky.
Sorry, yeah. I have one last question. So if we take the 2 vaccines, as you've said, you've taken it, Margaret. So if you take the vaccines, how long would it last for? Is it a 2 dosage that would last you forever, or do you need to come back and, you know, after a few years, take another shot?
I can speak to that if it's helpful. Yeah. So at this point, we don't know what we would call the duration of protection. So when we think about a vaccine, there are 3 critical elements we really want to focus on. One is, of course, safety. That's number 1. And then the second, when we look at efficacy, we break down efficacy into 2 categories. One is what we call quality of protection, the other is duration of protection. What that means is quality of protection, how well does it work? So we know how well these vaccines work. You know, for example, the Pfizer vaccine, we know it has 94% efficacy, so that's very, very high. What we don't fully know yet is how long does that immunity last. Now, the null hypothesis, our base hypothesis, is that there will be reasonably long duration of protection, but we don't know that yet, and that's a function of science. We've got to follow that up. And the reason we don't know that is because, remember, coronavirus itself is only, you know, coming up to just over a year old in terms of being a virus. This is quite a new virus, which we're still getting to know, getting to understand. What I would say, though, is that even if this does become a seasonal virus, a bit like influenza, what we would need to do in that situation is look to boost people, just like we do with flu. So every year you go and get your flu vaccination. And what the government would look to do through the JCVI and the MHRA is look at which groups are at risk, which groups really need to have their immune system boosted. So when I talked about that memory earlier, which sometimes can wane in some people, particularly older people or people with underlying conditions, it may be the case that they need to be boosted. Now, if that is the case, we will be in a situation where we can put that program in place. We've got a fantastic infrastructure in the NHS. You know, one thing I should say is that genuinely the UK is a world leader in vaccination. And one of the reasons we're a world leader is because of our National Health Service and our infrastructure. Exactly, people like Margaret. We've got so many brilliant Margarets in the system who know how to vaccinate, who know how to do this, because we've got, you know, an awesome routine schedule. So if we do have to move to a boosted program, that might be a minor inconvenience, but relative to the problem we're confronting, it's exactly that, a minor inconvenience. So we'll know more as we get more data, but the important thing is we do know these vaccines work. and now it's just a question of how often do we need to give them and to which groups. Teresa.
Yeah, thank you. This is a personal question, is how and who will notify me when it's my turn to have the vaccination? Is it the GP? Is it NHS? Is it phone call? Is it text? Is it email? And where are the vaccinations administered in Maidenhead? And last but not least, even after the vaccination, do we still adhere to face masks, social distancing, sanitisation?
Yeah, well, once again, epic question, fantastic question. So it should be your GP surgery via obviously the National Health Service that would make contact with you. That's usually done via a letter. It can in some cases be it depends on the contact details that the surgery has for you. It can be a text or an email, but it'll be one of those routes. Sorry, it's Winston. He's very well vaccinated, so he's all in favour of all of this. But so it'll be one of those routes. In Maidenhead, we have the Maidenhead Town Hall, which has been set up as a direct site, and also Windsor Racecourse. So it depends, of course, where you are geographically.
Okay.
For some of the cohorts coming through, the NHS has started to look at pharmacies. So that's for some of the cohorts to come in terms of being able to potentially administer in that setting. But for now, it's those big mass vaccination sites that are at the forefront of the campaign. And I think the final point you just raised there, such a fantastic point you raised, actually just reminded me to mention it. Absolutely, you have to still adhere to the social distancing requirements, the mask. So the old saying, which I know we're all getting a bit tired of, but hands, face, space, really, really important. And also the other thing just to note is even after you've had your first dose, remember it's critical you go and get the second dose when contacted. The second dose is there to provide a boost to the first dose. And even after that second dose, there is a need to allow the immune response to kick in, which can take up to 7 to 14 days. Even after then, very, very important, people play it safe and follow the guidance. So a really important point you've raised there.
Okay, thank you. Yeah, because my mother, who's 92, she's had the 2 Pfizer vaccinations, and my aunt, who's 90, has had a Pfizer vaccination.
Fantastic. Well, I mean, it's absolutely wonderful to hear that, and there's this high, probability we know from the evidence they're now certainly your mother will be immunised, protected, and your aunt is on the pathway to being fully immunised and fully protected. But even then, because no vaccine is ever 100% effective, people need to play safe. And it's actually to your earlier point as well, we don't quite at this point fully know what can happen in terms of transmission dynamics and onward transmission. So that's the other big reason why people need to stick to the guidance, because we have to be very, very careful about the fact, even though you may be protected, you could still be what we call a vector for the virus. You could still pass it on to others. So we've got to play it safe still. I know that's frustrating. I know it's difficult. I know we all want to get back to an open world, but the more we stick to the guidance, as well as getting vaccinated, the quicker we will get there. What we can't do is try and short circuit our way out of this problem. That isn't going to happen, I'm afraid to say. We've got to, get through this together, stick together, and we will get through it. We will get through it, but it requires every single one of us to play our part.
Okay, I'm my mother's carer, so actually I go into her every single day and I cook. So because we're together, obviously I don't wear my mask inside the house.
Yeah, I mean, obviously with masks, masks, I think very, very important, particularly when you're out, if you're out and about in public settings like shops, of course, it's key during this lockdown phase. People only go out for essential activity. Of course, shopping is an essential activity. I've actually, with my parents, been doing the dutiful, diligent son role, which has involved I'm sure Father Liam would concur with my strict discipline on them. It's done purely out of care and compassion, and I've said to them, look, please try and do more online shopping. Get shopping ordered to your house. Of course, go out for walks. Absolutely, that's critical for mental health. It's critical for physical health. But I really do advise people, as much as is possible, to think about the activities you really need to do versus you don't need to do. And in many cases with shopping, you can, get that ordered online and delivered to your front door, and you don't have to come into contact with anyone. The point on masks, I just would like to, because again, it's a really, really important point. Of course, there are some people who might be exempt from having to wear a mask, and the guidance is clear on that. So, for example, you have a respiratory condition, you're not expected to wear a mask. But what I would say there is, if you've got a respiratory condition, you should be shielding. You shouldn't be going out in the first instance. It's frankly too risky to be venturing outside. And again, I know that's frustrating for people. As we heard earlier, some people are effectively like having to be prisoners in their own house, and it's not pleasant. But for those of us like yourself who have sadly, lost someone or have someone in hospital at the moment ill from coronavirus, I think I know which one I would prefer, and that's someone getting cabin fever rather than coronavirus. And with a mask, just to be clear, there has been some confusion here that wearing a shield, if you're out and about, you can get the plastic shields. You can't wear a shield instead of a mask. The guidance is very clear. You can wear a shield in addition to a mask, but what's vital is that you wear a mask to cover the mouth and the nose, because the main way this virus transmits, and in fact is taken into the human body, is through the mouth and the nose. So you can wear a shield in addition to a mask, but you can't just wear a shield on its own. And that has caused some confusion, but the guidance is very clear, and it is clear for a reason, which is the main mode of transmission is through the mouth and the nose.
Hi, good evening. I wanted to say, so I'm 22. When COVID started changing everything, I was finishing my uni degree, and then since September I started my new job working from home. So it's been obviously this is a different year for all of us. I wanted to ask, when can my age group expect the vaccine? Because I know we're vaccinating from the more older population and then down through people who are more vulnerable. So for people who are younger, like me, like 22, kind of late teens, early 20s, when can we expect the vaccine? And then my second question is, I know you mentioned that the vaccine's not a fix-all solution. It doesn't mean that once you've had it, you can kind of go about life as normal. So as a result of that, will it be after my age group has been vaccinated, when kind of everyone's received it, people have had time to build up some immunity, is that when we'll see restrictions start to relax, or just around that point as well, when will we see things start to change in terms of our lifestyles?
Great. No, thank you very much. And well, it's a very difficult world for young people, so I do empathise and sympathise, and I've been speaking to a number of young people through my lead member for Children's Services role, and I really do feel for people who've had their education interrupted. And I also think, I'd just like to say this point, actually, I think we've got so many fantastic young people, and I get a bit tired and bored actually of people criticising young people and all this sort of stuff. We have fantastic young people who are doing fantastic things, and I think we need to remind ourselves that we're living in a very difficult world where people's childhoods and upbringings and education opportunities are being affected, and it's incumbent on all of us to support young people very, very robustly and enthusiastically. In terms of your point about vaccines, when will effectively all of us get the vaccine? You're right to say that there's the hierarchy approach that's been adopted by the JCVI, and the reason for that is quite straightforward. The vaccine's been given according to those most at immediate risk of death or immediate risk of serious disease, and we're beginning to work through those cohorts. So we're beginning to now get into the 60 plus cohort and people with underlying conditions. In terms of young people probably won't get the vaccine particularly quickly unless a young person has an underlying health condition. If you're in a category of having an underlying health condition, then you would be in that priority group as being clinically vulnerable. And that is a very, very important point to make. It doesn't matter how old you are. If you have an underlying health condition, you would be eligible to be within that priority cohort. The key thing here with the vaccination programme is, as you correctly say, to a degree, it's about population immunity. So the extent to which the wider population, the wider herd, to put it in those terms, is vaccinated and immunised. And this is why this point about onward transmission is so important, not just to the extent does the vaccine protect yourself, how much does it stop you passing it on to someone else? And the honest answer, as I say, is we don't fully know that yet. So that makes it very difficult, even when we do epidemiological modelling, to figure out how quickly can we push this virus back. And the one thing I just want to say, you know, we won't eradicate this virus. You know, the coronavirus is now here with us for forever and a day, just like polio, just like measles, just like any other infectious disease. What we need to do, just like we've done certainly in this country and certainly most developed countries and even developing countries for many of these viruses, is that we get them under control, but we basically push them back, and that they're then not in what we call the environmental space, the epidemiological space. So the incidence prevalence of these infections can't grow. So it's a bit like tightening a noose on a rope. The more we tighten it through vaccination, the harder it is for the virus to live, spread and get around. So the real key to this, again, is getting those priority groups vaccinated. The more they get vaccinated, the more that allows us to start looking at where we could potentially ease restrictions. My strong view, you know, and this is just a personal view, is that the first areas we need to look to ease is around places like universities and schools. You know, that for me has to be the priority. I know people are dying to get down the pub. You know, I know Father Liam and I are desperate to get a pint of Guinness. You know, and you know, I feel his pain. I think he feels my pain. But you know, the point here is, I think, as much as that is critical, obviously, for the pair of us, I think we've got to put schools and universities first. So I think that's where we've got to focus our attention once we've got to a level where we're comfortable that our number is relatively under control. And also once we know a little bit more about onward transmission. But, you know, I just want to repeat the message again that, you know, and this is going out to a lot of people, do think about young people during this period. I know I might sound like a broken record. People have heard me speak before. I mean, I'm still a millennial. I like to throw that in as much as I possibly can. But anyway, you know, the reality of it is that, you know, people are going through a very hard time, and we need to get behind our young people. And it's our young people, remember, who are going to actually be the people who solve all of this in the future. You know, it's young people who are going to have to deal with the economy and, you know, a lot of the debt that's going to be there. So I think young people should be front of the queue.
Why has the United Kingdom got the highest death rates? You know, Wuhan has practically eradicated coronavirus, and the United Kingdom is absolutely horrendous.
Yeah, I mean, this is a really important point. I think the ultimate answer to that, I'm afraid, so Teresa, is we can't fully answer that until we've done a full retrospective analysis. And what I think is good in this country is that, you know, Boris Johnson did commit very early to a public inquiry into all things coronavirus. And once we are through this pandemic, that inquiry will sit, and it will, because it's a public inquiry, leave no stone unturned. And I think that's right. What I would say is that we have to be a bit careful in terms of comparing one geographical location to another. There are what we would call, in statistical terms, regression variables, which we need to take into account. So that's natural parameters. So if you take, for example, the United Kingdom versus other areas, one, you've got to look at basic things like population. So what's the size of the population? So, okay, in the case of China, very big. Then you've got to look at things like what we call demographic density and intensity. So how close do people live to one another? The United Kingdom, 92% of the United Kingdom is green and pleasant land, or unpleasant land, depending on your view on certain parts of the country. I won't go into Sunderland here because I'm a biased Geordie, but the point there is that, you know, only 8% of the population is only 8% of the land mass is urbanised, or where people live. So what that means is, if you take the United Kingdom versus somewhere like Germany, where from memory, it's around about 65% green and pleasant land versus 35% urbanised, or people living on some form of land. The coronavirus is going to love the UK a lot more than Germany, because we've got more people who are closer together. We've got people mixing with one another a lot more. The thing this virus loves, if you're less than 2 meters apart, and even 2 meters, remember, isn't absolutely guaranteed safety, those particles, those molecules can just spread. So there are some natural parameters here. And the other one I'd mention is incidence prevalence of underlying health condition, average age of the population. So the UK has one of the bigger epidemiological incidences and prevalences of underlying health condition, unfortunately, which is something we need to look at as a country from a public health point of view, you know, in terms of obesity, in terms of smoking, in terms of drinking, in terms of diet, so on and so forth. So again, you know, if you look at that from a starting base, the virus is going to like someone who has got an underlying health condition versus someone who's fit and healthy. And then again, if you look at average age of populations, the younger your population and average age is, again, the virus is going to find that harder versus a population with a higher average age. Then, of course, on top of that, you've got to factor in government intervention. How optimal has government intervention been? Has the government locked down at the right times, implemented the right measures, the right restrictions, the right support packages? There's no doubt about it, that has an effect. But what I would urge people to do is be cautious about thinking it's just government intervention alone, as important as that is, and there's no doubt about it, that's important. There are these natural variables which would mean that certain countries, sadly, would have a higher death rate, a higher number of cases versus other countries. And then, of course, just one other thing I'll throw into the mix is social norms. You know, if you take certain parts of Asia, back when I was very young, I lived in Singapore, so I remember this fairly well, and travelled around Asia a bit as a young lad. Not on my own, I hasten to add, my parents were with me, but you know, the norms are different. A lot of the Asian societies aren't as tactile as we are, so they don't actually, you know, hug, kiss, embrace as much, whereas obviously a lot of our Western countries, we're quite used to that. So if you take the first wave of the pandemic, before we really got measures in place and were under control, we were still sort of shaking hands and embracing one another, so on and so forth, which again, the virus loves. You know, the virus really likes that. And of course, in certain countries, they're better equipped, or they're more used to dealing with these kind of lockdowns. We've seen in South Korea and other parts of Asia, the SARS virus. So they've sort of got a cultural history, a more of a cultural assimilation to having to deal with these kinds of problems. So there are lots of factors, basically. It's difficult to pinpoint one. Government intervention is definitely one of them, but it's by no means the only variable.
Okay, thank you.
Stuart, could I just ask, just going back to children, I've got 2 little ones in primary school. Is there a plan to vaccinate them? Do you know anything about it? No.
Well, I can hear in the background some strong advocacy coming in there for an immediate vaccination, and I like to see the political campaign start quickly. So I'm all in favour of that. At this point, the answer to that is no, in the sense that these vaccines aren't actually licensed from their clinical trials for very young children. I mean, again, it's something that the science, the evidence base will need to look at. We have, for example, with influenza, as you'll know, we've moved, you know, it would have been, I think, almost coming up to 10 years ago to introduce in a paediatric vaccination, the nasal vaccination called Fluens. And the reason we've done that is not so much to directly protect the child, although there are children with underlying health conditions who absolutely should be vaccinated against influenza for their own health, but more because kids are what we call super spreaders, vectors. They can, easily spread it to the grandparents and others, and you almost want to create that herd protect that Teresa was, asking about earlier. Now, in the case of coronavirus, it would appear that sort of child to adult spreading is less of an issue in terms of transmission. It's not to say it's not an issue, just it's less of an issue. But as we see different variants of the virus emerge, that could change thinking again about how important it is to potentially protect the childhood cohort, not necessarily to protect the vast majority of children directly, but to effectively create a herd immunity effect, a herd protection. So at this point, it's difficult to know where the future may lead us there. I think, though, what we do need to do is keep our focus on those groups that are at risk of death, risk of serious illness. That's where the NHS needs to rightly focus its precious time, effort and energy. Once we get through those cohorts and we understand the science better, the programme could adjust, and maybe manufacturers will investigate producing paediatric vaccines similar to influenza if there is a health benefit to be gained there.
I wanted to ask, so I know that obviously getting the vaccine is voluntary, but what will be the consequences if you don't get the vaccine? So will you have certain restrictions placed on you? Like, for example, will you be able to travel, or will you be able to go to certain areas? Will companies be requiring proof of the vaccine in the future?
Yeah, what a great question that is. I'm an epidemiologist. I'm not a clairvoyant, sadly, so I can't fully answer your question. But I'll give it a go. In terms of what I think may be the case. I think what you're touching upon there is really important, which is the world as it's going to be tomorrow is going to be different. And that's a statement of the obvious. But I think in many ways, I could see governments, organisations wanting what we call vaccination passports. I think that is a live possibility. Now, there are some equity issues around that and maybe legal issues, but frankly, when you've got a pandemic and you've got a virus that's ripping its way around the world, you can understand why that might frankly have to take precedence and might have to be prioritised. I think it's another good reason, actually, and I hadn't quite thought about it this way, but you've just provoked this thought in me for people to get vaccinated, because if you haven't, you might end up actually perversely enough having restrictions placed on you if you want to go certain places or you want to do certain things. One thing I would say is I'm not personally in favour of mandatory vaccination. We do see it in some countries. For all of my passion for vaccines and for all of my love of vaccines, I think it's a dangerous trend to go towards mandatory vaccination, because I think that actually gives the anti-vaxxers a lot of oxygen in terms of saying, well, look at this, it's the government and they're being Orwellian and it's 1984 and, the clock strikes 13 and all that sort of stuff. And I think what, like with most things in life, you win. You have to win the argument. You can't force it onto someone. I think if you try and coerce something onto a society, a population, it doesn't really work. I'd much prefer to see us do this kind of forum, do this kind of thing, and really push it through education, rather than saying you've got to have it. And I don't think that's the sort of society we are. I think we're the sort of society that it is about liberty, it is about freedom, and I suppose it's about belief. In a strange way, it's a bit like faith. You can't force someone to believe. They've got to want to believe, and they might need some encouragement and some help along the way and some direction. But you can't sort of say to someone, "You're going to believe in God." That's got to be their personal decision. So I think vaccination is a bit like that. But it's through these kind of forums, it's through this kind of awareness that I think we can really push the argument, win the argument, and win the argument positively.
I just wanted to say that the Pope said that he felt ethically everyone should receive the vaccine. He added that in not taking the vaccine, people were not only putting their own health at risk, but also that of others. And that was in the Independent on Sunday, the 10th of January. And both Pope Francis and former Pope Benedict have received the first dose of a coronavirus vaccine.
Absolutely, a fantastic message from the Pope. I've actually, I was saying to Father Liam a few days ago when we were speaking, in my current role working for the government, I've actually been liaising with the Vatican. It's amazing where this role has taken me, but the Vatican have been fantastic. And they have actually been historically very, very good in terms of leadership on all vaccines, because, there have been some ethical questions, not actually with the COVID vaccines, but other vaccines about their ingredients and what's in them. And every single time you've had the sitting Pope, give an exemption or make it quite clear that it's the Church's position you should get vaccinated. I think that's an incredibly strong message, and that when you have the former Pope and the current Pope again stepping up to the plate and having the vaccine, I think that's an incredible message to send out. And as someone who works in public health, I'm really, really grateful for that, because someone reminded me the other day, people, when you get asked the question, it's a bit of a trick question, who's the most powerful person in the world? People would usually say, well, the President Joe Biden as it is now. But actually, the person with the biggest sort of following, as it were, is the Pope or the Vatican, when you just look at the number of people. And so actually, when you think about that, message is pretty important, to get out to a lot of people. So, I think it's very, very positive indeed. I don't know if there are any final questions before we seek to wrap up. I'm happy to take any more. I will take the silence as a no. Perhaps before we do so, I'll just give the opportunity to pass back to Father Liam if there's anything he would like to say in terms of final message, and then we'll just hand back to Gurpreet to wrap us up. But thank you ever so much for all the questions. Brilliant questions, and I'm really grateful for your contribution to this really important topic.
And Stuart, thank you for inviting us on. I have learned so much this evening, the past hour, things that I didn't even think about. It is an amazing hour of education and enthusiasm, that this is something morally, ethically, and for community that we must do, and we must encourage people to get this vaccine. I'm just waiting for my age block to come, Liberty, so that I'll be the first in the queue. I'll be down there getting my injection. And I just wish everybody well, and thank you very much.
Thank you very much indeed. I'll pass back to Gurpreet just to close us out. Thank you.
Yes, thank you, Father Liam, again, and thank you all the members today for joining us today. It's been a very, very good Q&A discussion today, and I would like to thank Councillor Stuart Carroll for answering the questions today. I hope it's allayed people's fears at least a little, and as I will also confirm, my mum and dad have had the vaccine as well, so it's very important that everybody has the vaccine. But once again, thank you again for joining us today, and I wish everybody a good evening. Thank you.
Thank you.